Important chemical compounds known as neurotransmitters are released by brain cells called neurons. These neurotransmitters send messages between neurons and throughout the body. This is like sending mail from one person to another when we want to relay a specific message. Usually, within the body, there are set levels of certain neurotransmitters present. However, in a person with bipolar disorder, this balance can change and this can result in depressive, manic, or hypomanic symptoms. Dopamine is a chemical compound that plays many roles and is associated with making an individual feel very active and happy. However, in bipolar disorder, the levels of dopamine are elevated, which leads to the mania and hypomania symptoms. At the same time, low levels of dopamine can make someone feel unenergetic and tired, which puts them into a depressive state. Serotonin is a chemical compound which acts as a mood-regulating neurotransmitter, along with influencing behavioral functioning. For example, serotonin may play a role in pain sensitivity, motor activity, feeding, aggression, and sexual behavior. Abnormal levels of this neurotransmitter have been associated with depressive symptoms. However, there is still research needed to be done to see what role serotonin plays involving manic symptoms in bipolar disease. With this in mind, there is still ongoing research involving dopamine and serotonin and what they do specifically in bipolar disease. Now we know the biological aspects of bipolar disorder, so let's look at some treatment options to help these individuals. These may include antidepressants, mood stabilizers, and anxiety medications. These typically can help prevent mania episodes, stabilize mood swings, decrease anxiety, and improve sleeping patterns. So are there treatments other than drug therapies? Yes, there are. An example is cognitive behavioral therapy. This is an effective treatment in decreasing the depressive symptoms in bipolar disorder. It can also help decrease relapse rates, mania severity, and improve social functioning. Cognitive behavioral therapy helps the patient to become aware of his or her feelings and think of ways in which to deal with their emotions and/or thoughts in better ways. In this case, bipolar patients have distorted cognitive thoughts and thus proved an effective non-pharmacological treatment option.
John thought this was very interesting and intriguing how someone could come to be happy or sad and change moods almost instantly due to chemical imbalances or changes of certain hormones. John was very interested in what his teacher had taught today and decided to gather a bunch of his classmates and friends to start a mental health awareness group to educate his school about diseases such as bipolar disorder and other mental health related disorders. John was very motivated to start this group to improve his social interactions with others again and started to feel like himself without worrying about self-diagnosing himself, as he would leave this for a healthcare professional.
Those of you who do not know what that is, manic depressive psychosis is a bipolar affective disorder, which is characterized by severe alterations in mood that are usually episodic and recurrent. This mood fluctuates between depression and mania. Now, in acupuncture and Chinese medicine, depressive psychosis is caused by qi stagnation, complicated by phlegm misting the heart's orifice. It is characterized by depression, apathy, incoherent speech, dementia, and subdued and nonviolent behavior. In Chinese medicine, this disorder is called Dian Quan.